Hello everyone, welcome back to another guest speaker session from Innovative Astrosolutions. Astrology and Ayurveda have a very close relationship. In fact, in ancient times, astrology and Ayurveda were practiced together. But later on, the Ayurveda has been moved to medical science, and astrology remain as a mystic science till today. So today, I have invited Dr. Milind. He is an Ayurvedic doctor, and he is the very right person to talk about this topic: Ayurveda, medical science, and astrology. So Dr. Milind is not only a Ayurveda doctor, he also certified in yoga science, naturopathy, Reiki, and pranic healing. So with this all skills, he is helping a lot of people, and I'm really proud to have here today. So you can contact Dr. Milind through his email ID mentioned here, and also his phone number is also mentioned here. So anyone who is looking for help, you can definitely contact him. So thank you, Milind, for joining today and accepting this invitation. So it's all yours now. So let me stop sharing. You can take it from here.
Thank you, Mr. Muthu Vijayan sir. Thank you for the opportunity to represent myself here in front of all of you. And thank you for all the enthusiastic people who has joined this workshop here. Because this is the weekend time period and most people spend it while having the relaxed time period, and you are here spending the time by giving this time period to know about the medical astrology. So yes, all the cheers for you as well. So yes, we are going to represent the slides just in a minute. So first of all, we will start our presentation by remembering the Vignaharta, Lord Ganesha, who is the remover of all the obstacles. Vakradunda Mahakaya, Suryakoti Samaprabha, Nirvignam Kurume Deva, Sarvakaryeshu Sarvada. Astrology is a very divine science, and I personally believe, and my gurus, they also believe that you have to pray to at least one deity in your life, because astrology is not just the logical science, but it also works on an intuition base as well. So it is my belief, and my guru also suggested me that you should also pray to one deity. So we will move forward now. This is, we are talking about the medical astrology. So if we know about that, what is the medical astrology? It consists of the two words, medical and astrology. Medical means the medical science, and astrology is the science that we are going to talk about. So the medical astrology is basically the branch of the astrology that works on association of the human body, organs, and the diseases with the different planets and the zodiac signs. So as the name suggests, it requires the knowledge of basic four things. It is the human anatomy, human physiology, the basic understanding of the diseases, and four, and the most important thing is the astrology. Back into the past, when the Ayurveda was taught in the Vedic time period, astrology was also taught as a part of the Ayurveda. Vastu Shastra was also taught as a part of the Ayurveda, because astrology and Ayurveda, they both were connected to a very good level. But as Mr. Muthu Vijayan sir has suggested, that whenever the time progresses, the Ayurveda get diverted only into the medical science, and the astrology is now here. But we have this capacity to combine both of the them. Now we will see what is the connection of Ayurveda and astrology. Ayurveda is not only the Veda that discuss about the diseases and the remedies by the herb. It also discusses many other methods, like the astrology, vastu, etc. Like in the Chikitsa San of the Charak Samhita. Charak is the book which is the materia medica of the Ayurveda as well. It also consists the diagnosis, treatment of the various diseases. In the Jwara Adhyaya, Jwara means the fever, any kind of fever that comes into the Jwara Adhyaya. In the Jwara Adhyaya, it has also been mentioned that you should chant the Vishnu Sahasranam as a part of the remedy. You should also strengthen your sun as a part of the remedy to the Jwara. Though Charak Sahita mentions the three type of the treatments here. First is the Yuktivya Prashya Chikitsa. The Yuktivya Prashya Chikitsa is currently mostly all the Vaidya or mostly all the doctor follows this Yuktivya Prashya Chikitsa. In the Yuktivya Prashya Chikitsa, we go to the doctor, we go to the Vaidya, we go to the homeopathic person. They will ask you question, they will diagnose you, they will go through the vitals of your body, check the signs and symptoms of your body, and then they will prescribe you the medications. Like they will prescribe you the Gutika, they will prescribe you the Lepa, Asava, and the Arista, and the various different type of the combination of the herbal medicines and also the Ras Aushadhi medicines as well. So this is the Yukti Prashya Chikitsa. This is the normal type of the treatment that we go through every day. Second type of treatment is mentioned as the Sattva Vajay Chikitsa. In that, there are two main things. First is the Mano Nigraha. It indicates that we have to strengthen our mind in order to go for this type of the chikitsa, and we should also go for that cause that is triggering the particular types of the signs and symptoms in that particular patient. Like if any person is allergic to the lactose, you may have heard the term as a lactose intolerant. So the main chikitsa or the treatment is the patient should not consume any product that contains the lactose. So we should remove all the dairy type of the products in the food items of that particular patient. This is called the Sattva Vajay Chikitsa. And third and the most important chikitsa or the type of the treatment is mentioned as the Daivavya Parashray Chikitsa. Daivavya Parashray Chikitsa is the chikitsa in which it is mentioned that if you are doing the Yuktivya Parashray Chikitsa and the Sattva Vajay Chikitsa, both are the type of the treatment, but you are not getting the result, then you should go for the Daivavya Parashray Chikitsa. And the astrology comes in that type of the treatment. It is a Daivavya Parashray Chikitsa. There are many methods in the Daivavya Parashray Chikitsa: Mani, Mantra, Aushad Dharan, Bali, Hom, Swasti Upchara, Ishwar Pranidhan, etc. etc. There are many type of the Daivavya Parashray Chikitsa, and the astrology is connected in that type of the Chikitsa as well. Ayurveda also mentions the type of the nakshatra in which the particular herb should be picked, because the Ayurveda believes that in that particular nakshatra time period, that herbs are having the maximum potency or the maximum effects if that particular herbs is taken in that particular time period. There are many other diseases in which it is mentioned that if you are having that particular symptoms in child, you should go for having the Aushad Dharan. Aushad Dharan is like you are not consuming it by the mouth, but you just wear that particular type of the Aushad, and that is the treatment. So Daivavya Parashray Chikitsa is a very vast subject, and astrology comes as a part of this Daivavya Parashray Chikitsa. And this is the Ayurveda. Now we can. There will be a question arising that what about the Hippocrates? Hippocrates has also mentioned that a very famous quote: "A physician without the knowledge of the astrology has no right to call himself as a physician." So astrology was a type of a tool in the Ayurveda as well, or in the allopathic medicine as well. But as the modern science started to progress, the part of the astrology that started to get lessened. But I personally use astrology as a part of the tool in my daily clinic, in my daily OPD patient, in my daily IPD patient, and I am getting the result out of them. So we will discuss the same thing here as well. One more thing that every person should note and apply: medical astrology should be used along with the active therapy the patient is taking. It can be any therapy. It can be the allopathic science, it can be the Ayurvedic science, it can be the homeopathic science. It should be used as a supporting tool. No one should advise the patient that stop all the allopathic medicine or stop all the Ayurvedic medicine and only go for the medical astrology. Medical astrology is an accessory tool, because the prime motive for any type of the therapy is that we should decrease the symptoms of the patient. We should give them the comfort and not increase the chaos that is already happening in the body. So this is the most important thing to note and apply. That I will also request all the viewers here that we should use medical astrology as a part of an accessory tool here. Now, before we go for the diseases, that what are the diseases and how it affects our system, we should know what is the definition of the healthy person as per the Ayurveda. Ayurveda has a sloka or the versa. It indicates as samadosha, samagnischa, samadhatu, malakriya, prasanna atma indriya mana swasthamitya abhidhiyate. It indicates that the person who has a sama dosha. Ayurveda has a three type of the main dosha: vata, pitta, and kapha. all the doshas should be balanced. No dosha should be elevated. No dosha should be decreased. If there is any kind of imbalance, then the person will start to have the disease. The second definition is the Sama Agni. There are many type of the Agnis mentioned in the Ayurveda. The first is the Jatragni or the digestive juice. It indicates that the patient should have a balanced Agni or the balanced fire or the balanced digestive system. There are many also other Agnis that is mentioned. It is called the Dhatva Agni. Ayurveda has mentioned the seven type of the Dhatu, which is the Sama Dhatu. Rasa, Rakta, Masa, Meda, Asti, Majja, and Shukra. These are the primary seven ingredients which create our body that we see here. So Dhatvagni is the digestive juice which transform the ras into the rakta into the masa into the meda into asti into and majja into the shukra. These are the balanced dhatu and the balanced mala. It also indicates that the waste product that gets produced by the different metabolic process should be also balanced. It should not be very much higher, it should not be very much lower, but it should be balanced. So this first line of this particular verse indicates the physical symptoms: samadosha, samagnisha, samadhatu, malakriya. But Ayurveda also focuses on the mental health as well. It indicates this Prasanna Atma Indriya Mana, means a happy soul, happy mind, and happy sensory organ. Then only you will be called as a healthy person. If you are healthy by your physical shape, then you are not healthy. But there should be a connection between your physical health and the mental health as well. So now we will have a little indication about what are the different type of the dosha. A little points about the vata dosha. Vata dosha is mainly made of the two type of the constitution. This is ether and air. It indicates Akash Tattva and Vayu Tattva. There are few points that indicate the Vata dosha, that are the characteristics of that particular Vata dosha. First is the dry or the ruksha. The person who has the Vata dosha elevated will have the dry skin, dry hair, dry nails, dry lips. His voice should be hoarse. It also indicates some mental symptom that that particular person will experience the loneliness. That particular person will also experience the fear. Second is the light. Light means the low body weight. The person will also show the symptoms related to anxiety. The body frame will be small or the frail. The sleep will not be very much deep. It will be very light. With the little sound, it can be get disturbed. There is also other characteristics like the cold. If you touch the hands of that particular Vata dosha people, it will be felt as a cold because the circulation is a very pure. Whenever the Vata dosha person will get arise in the morning, there will be stiff muscles. Other symptoms are the rough. And the skin will be rough skin. Whenever that particular person moves his joint, there will be cracking joints. Its mood will be very cynical. There are also some of the symptoms like fear, anxiety, insecurity, emotions. There will be little tremors or the addictions of that particular any type of the drug. That Vata dosha person who has the Vata dosha elevated or their Prakruti is mainly dependent on that Vata dosha. He will be the person who walks very fast, who talks very fast. There will be a restlessness in his voice and his character. There are also chances that he may be a little insecure about that as well. And other thing is that there are chances that it will be in isolation. But Vata dosha means Vayu, so it will also like to get creative. He understands the information, grabs the information, but it also forgets the information very quickly. So these are the main characters of the Vata dosha, or the people who has the Vata dosha elevated in their body, or the people who are having the Prakruti of the Vata dosha. Second, we will go about the Pitta dosha. Pitta dosha is made mainly by the fire and the water. It is the Agni and the Jala. So there are characteristics of the Pitta dosha is the hot. The person will be very passionate. The person will also have the anger issues as well. If you touch the hands or the legs of that person, there will be temperature which will be very high body temperature. You maybe ask that if you are you having the fever, but the person will reply that no, this is my normal body temperature. If you ever touch that person, you will feel a little higher than the normal person. As the pitta dosha is made of the fire, he will have a very strong appetite. Whatever food eats, it will get digested very properly. As there is a fire as well, there is a very sharp memory, very sharp intellect. But whenever the fire is there, irritability will also be there. But the person will be able to give the concentration to particular subjects or the talk that he is in. There is also the light guna, light characteristic. He will have the bright eyes. His body frame will be light, but he will be also alert. The skin type will be very oily. The pickers can be also seen as a oily. As fire and water both are getting mixed, there will be excess urine or the sweat. Sometimes when the pitta dosha is very much elevated, there are chances that the person will have the signs and symptoms related with the liquid stools or the diarrhea like that as well. Other thing is that whenever the fire is elevated or the pitta dosha is elevated, you can experience the symptom of the rashes, acne. These are the symptoms whenever the person enters the puberty. All the people will face the problem of the acne. But whenever the pitta dosha is very much elevated, there will be higher acne issues with that type of the person that we will discuss in the presentation. Pitta dosha person also shows some positive things like the leadership quality will be there. As the fire is also involved, he will be always seeking the fame here as well. Now we will move towards the Kapha dosha. The Kapha dosha is made of the two element, earth and the water. Both of the these primary ingredients, earth and the waters, are very settling type of the character. It gives first is the heavy. If you see that person, you can see a very large body frame. As he is a very large body frame, he also able to gain weight very easily. Now, there are many persons who will say that I eat very less or I do not do very high junk food in diet, but still my weight is increasing. So that person is having the prakriti of the higher kapha dosha. Due to the heavy weight or due to the person who is having the more fat than any other person, the lethargy symptoms will be there. The person is also, if you observe them, they will be very slow in the walk, they will be very slow in the talk, they will take time to digest, but there is also the patience will be there. He will be able to listen to the person what the person in front of them is talking. If you touch that particular person, there will be cold skin. But the cup type of the persons are very prone to the cold cup congestion and the stagnation. Whenever the winter comes or whenever there is a cooler environment, they will start to experience the symptoms related to cold cup congestion and stagnation. There is also a characteristics of the oily, well lubricated skin and the joints. Their skin will be very smooth. The person will be having a calm nature. He will be very flexible as well. There will be a skin that is a very thick nails and hair and the thick subcutaneous bed. Strength will be seen. But though the person is having a very much strength, he will be soft. He will show the compassion and the tenderness as well. The person will be attracted to a very sedentary lifestyle. He will be very supportive as well, and he will prefer the jobs or the type of the work that gives him the stability, because there are two type, earth and the water, both are a very stable type. And the last thing is cloudy, sometimes due to the kapha, sometimes due to the lethargy, sometimes due to the slow processing. There is often foggy minded, but whenever the kapha dosha is there, stability and calmness and the patience can be indicated here. Now, we have gone through the three type of the dosha, and now how each planet is connected with each dosha. We will start from the sun. So, as we can just imagine, the sun is a very hot star. The sun is directly linked to the pitta, because sun is also indicates the fire and pitta also indicates the fire. Second is a chandra. That there is a kapha and a vata. So Chandra is a planet that is also indicates the stability, but Chandra completes its orbit very fast, so there is also a tint of the Vata as well. Mars is a fiery planet, and we can connect the Pitta to the Mars as well. Now Mercury, there is a one interesting thing about the Mercury, that it indicates all the three dosha. And if we go through the astrology books as well, it is indicated that the Mercury is able to take the shape or can change according to the planet he sits with. If he sits with the malefic planets, he will start to give the malefic result. If he sits with the benefic planets, it will start to give the benefic result. So Mercury is indicative of all the three doshas. There are signs and symptoms of all the three doshas in the Mercury. As the Kapha is indicated, it is a very stable, it is a very calm, it is a very knowledgeable dosha. So Jupiter also indicates the connection of the dosha. Jupiter is with the Kapha. Venus is also the Kapha, because Venus is also linked with the Shukracharya sometimes, because Venus is also linked with the knowledge as well. So Venus is linked with the Kapha and the Vata. And last, the Saturn. Saturn is the pure Vata planet. So this is the main connection of the dosha and the planet. So whenever the patient comes to the clinic with a particular type of the symptoms, like he is having the inflammation of any joint, then we can say that there are chances that his sun is getting trouble somewhere, his Mars is getting trouble somewhere, because if there is an inflammation, there is always a link with the sun and Mars. If the person is having a gastric troubles, there are also chances that patient Saturn is getting trouble here. If the person is getting issues with gaining the weight, then we should give the remedies related to the Chandra, related with the Jupiter, and related with the Venus. So this is the basic understanding of how the connection of the dosha and the planets are there. Now the next step is, we talked about the planets, about link with the doshas. Now we will talk about the zodiac signs and how they are linked with the different type of the doshas. I am making it as simple as possible, because many of the people who has joined the workshop are having the beginner. So this is as basic. We can understand that Aries, Leo, and the Sagittarius, they are having the fire element. It is mentioned in the Bruhat Parashar Hora Sastra. And as Pitta is made of the fire and the water, so Aries, Leo, and Sagittarius, they are linked with the Pitta dosha. The person who is having the Aries ascendant, or the sun in the Aries, or the moon in the Aries, they are prone to have a Pitta. There are many other things that we should discuss, but this is the basic understanding that the person can have the signs and symptoms of the Prakrutis linked with the Pitta. Taurus, Virgo, and Capricorn. They are linked with the Vata dosha, because it is having the earth element here. Gemini, Libra, and Aquarius, they all are the mix. They are having the air element. Mix in the sense they are able to give you the Vata issues, they are able to give you the Pitta issues, and they are able to give you the Kapha issues as well. And all the watery signs, the Cancer, Scorpio, and the Pisces, are linked with the Kapha dosha. So this is the basic understanding, that we know which planet indicates which type of the dosha, and now we know which type of the zodiac sign are connected to which type of the dosha. So main basic understanding, we can see that if the first example we can take, that sun is placed in the Aries, or the Leo, or the Sagittarius. So sun is indicated with the Pitta dosha, and it is in the Pitta sign as well. Then there are higher chances that person will face the signs, symptoms, or the diseases linked with the Pitta disorder. It can be linked with the inflammation, it can be linked with the burning sensation, and whenever that particular Mahadasha part or the Antardasha part arises, or whenever there is a particular transit that triggers it, then the person will there are higher chances that person will face the hyperacidity issues. They will face the migraine issues in that particular time period. So these are the basic understanding here. Now we will have the basic understanding of how the human anatomy is connected with the zodiac sign. So there is a verse in the Bruhat Parashara Shastra that Shisha Nane Tatha Bahu Rat Ko A Kati Bastayah Guyaro Yugale Janu Yugme Vai Jangake Tatha. So this is the body, and this is the part. This first part is linked with the arise. From the eyes and to the neck part, it is linked with the Taurus. Face and neck are linked with the Taurus. The shoulder part and the hand part are linked with the Gemini. In many of the materials or in many of the shastras, sometimes the thyroid glands is linked with the third house as well. Some people indicate the voice box to the third house as well, but there is no major difference. If you are having the issue, you can check for the second and third house as well. Whenever there is a cancer sign, it is linked with the thorax, chest part, heart part, and the rib cage. In the Leo, there is a Leo. Heart is sometimes indicated with the cancer, but sometimes heart is also linked with the Leo. Digestion system is also linked with the Leo. Liver, pancreas, and the small intestine is also included with the Leo. In the Virgo, there is a large intestine, and the kidney part is also goes into Virgo, and so on. We can go with that. Okay. This is chart, and this is that particular type of the organ and the system. Like we have mentioned that belly, pancreas, and the digestion is linked with the fifth house. This can be having a little connection here. If the patient is having any issue linked with the digestive system, then we should check both the houses, not a particular house. Fifth and sixth house both should be checked. If the person is having the issues with the communication or having the stammering or having the issue, then we should check the second and third houses, because sometimes the voice box is mentioned in the second house, sometimes it is also linked with the third house. So this is the only thing that we should check here. Large intestine and the kidneys are linked with the sixth house. Seventh and eighth house, both the houses are linked with the private part, uterus part, lumbar vertebrae, scrotum as well, here hips as well. So whenever any patient comes with the issues linked with the infertility, or they are having the issues linked with the impotency, then we should always check the seventh and eighth, both the houses as well, because there are many chances that it can be linked with the testicles, it can be linked with the other symptoms. So we should check both the things. 9, 10, 11, and 12, they are things. Ninth house is linked with the thighs. 10th house is also a very important house, because it is linked with the knee joint and the bones, because nowadays many of the persons are going for the knee replacement surgeries. So 10th house is also very important. The shanks part and the left ear also comes into the 11th part, and left eye and the feet comes into the 12th house. Many persons are having the flat foot, so we should always check the 12th house. And this is the Kala Purusha Kundali. As we have mentioned that in the first house, we should go for the head, brain, and the cranium, but also with the sign arise, we can also link the head, brain, and the cranium. So there are both the method we can go through. First, we will go through the houses that is connected with that particular organs, and if that house is not having the problem, then we will go to the particular sign. Like if any person is having the cardiac surgery, then we should go first to check the fourth house. But if the fourth house is not having any particular problem, then we should also check the cancer sign as well, because sometimes there is a no affliction of the fourth house, but the cancer sign is severely damaged. Then the person can go for the cardiac surgery as well. Now, this is the major connection with the human body. It is also called the Karakatva. Like if the patient is coming in your clinic or coming in with you for your astrological condition, these are the main thing that you should check first. If any person is coming with the issues linked with the bones, then you should always check for the sun. If the person is mentioning that he is having the issues with the blood or the lymphatic system or the fluid, then you should always check for the moon. Mars is linked with the bone marrow, that indicates the red blood cells. It also indicates the different mechanism as well. It also indicates the immune system as well. Mercury is linked with the skin. Jupiter is linked with the fat. Venus is linked with the semen in the male and ovum in the female. And Saturn is linked with the muscle. These are the major connection. We will discuss the many other things as well, but these things should be remembered that any person that comes, you should first check in that order according to the signs and symptoms that the patients are telling. Now we will have a little bit detailed look how we should go for the each planet and if patient is having that particular issue with that system, like the sun, as we mentioned, that sun is related with the bone, sun is related with the heart. If the person is having the issues with the eyes, then we should also check for the sun. The person is having the issues with the spinal cord, then we should also check the placement of the sun. The spleen, if any person is having the issues with the spleen, there is the inflammation of the spleen or the spleen has increased in the size, then we should go for the sun in the transit, sun in the Mahadasha, and the formation of the bile. Second, if the person is facing any type of the brain function, issues in the brain function, issues in the central nervous system, the vocal cord, the way the person is speaking, if the person is not able to speak, if there is a formation of the nodules near the vocal cord, then you should always check for the mercury. If the person is having the stammering issue, then you should always go for the mercury. Mercury is also related with the bronchial tube. The bronchial tubes is linked with the lungs part. So if any person is facing the issues with the lung, then we should also go for the mercury here as well. Mercury is also linked with connecting the esophagus, the thyroid gland, and the hand skill as well. So if any of the symptoms is linked, we should check the mercury. Now the Venus, it is linked with the urinary bladder, the sexual organ, semen analysis, or the ovum formation. Kidneys are also linked with the Venus. For some part, if there is a problem with the eyesight, then we should go for the sun. If the person is having the connection with the eyes, then we should also go for the sun. Hair is also seen from the Venus. If the moon is mainly connected with our thinking system, it is also seen whenever there is a psychological connection is there. If the person is giving the any issue linked with the depression, anxiety, then we should always check for the moon. Moon is also linked with the esophagus, the lymphatic system, the thorax part, the lungs, brain, mammary glands, uterus, ovaries, body fluids, and it is also linked with the eye. Mainly, the sun and the moon should always be checked when the person is having the connection, like the retina degeneration is there. There is issue with the degeneration. There, we should always check for the sun. But whenever there is a regeneration is required, then we should always go for the Venus. Mars, as we mentioned, that Mars is linked with the bone marrow, so red cells are linked with the Mars. Muscles are also linked with the Mars. As muscles are linked with the Mars and attachment of the muscles are the bone, then we should also go for some issue. We should go for the when there is a sprain is concerned and bone is just a part of them, then we should go for the bone. Male sex organ is also linked with the Mars, liver, spleen, rectum, and hemoglobin. This all the point. Any person is facing the issue, we should go for the Mars. Now the Jupiter. Jupiter is linked with the fat, glycogen, fibrin, cell formation, and the growth. Any problem with the hips, thigh, feet, liver, pancreas, and the intestine, then we should always go for the Jupiter, because Jupiter likes to increase the things in a very slow and steady manner. So any problem arises, we should go for the Jupiter. And for the Saturn, skin, teeth, joint, bone, ligament, muscle, legs, back, excretory system, then we should go and check the Saturn. Now the question with Salah is, we have discussed all the physical planets. So where are the Rahu and Ketu? Rahu and Ketu, wherever the Rahu is placed, there are chances that that particular house will get energized a very big way. So there are chances of expansion or the sudden expansion, but there are chances that the person will not have very proper diagnosis in a first time. Whenever the Rahu is concerned, you should get always get a second opinion, because you will get diagnosed by the other diseases and you will not get treated by the disease you are facing. Like if the person is having the tuberculosis, but he will get diagnosis as the other respiratory issues, and the medicines linked with the tuberculosis will not be started, then the person will having the prolonged treatment. So we should always check the route. Ketu is the planet wherever it tries to cut or detach. So wherever the Ketu is placed, we should always take care that the surgery or the small medical attention gets to that particular houses. Now, other thing, major important thing, this is very primary that we should check whenever any person comes with the health issues in front of you. Then the Dushtana houses, 6, 8, and the 12th houses. You should check the planets that are placed in these houses, 6, 8, and the 12th houses. This is a very basic understanding that whenever the planet is placed in that houses, sixth house is the house of the diseases. So whenever the planet is placed in the sixth house, there will be issues. Therefore, it is also mentioned that the malefic planets do better in the sixth houses because you have the better capacity to fight with the diseases, with the enemies, or with the deaths, because there are malefic planets as well. Eighth house is the house that is also called the Randrasthana or the occult house, that we are not able to see what is behind that Randra. So eighth house is also linked with the Dushtana houses and the 12th house. So whenever any benefic planet goes into the 6th, 8th, and 12th houses, there are major chances that person will in go through that particular diseases if that Mahadasha arises or it gets triggered by the current transit. Now we should also check the placement of the Lord of these houses and which houses and which planets they are aspecting. If the houses and the planet they are giving an aspect is powerful, they are able to fight, and then there should be no symptoms. But if the planet is alone, weak or debilitated, then there are higher chances that the patient will have the issues or signs and symptoms related with that. We should also go for the malefic planet placement, like where is his Mars, where is Saturn, where is Rahu Ketu axis. These are very basic condition we should see. We should also see that if there is having any benefic planet aspect or the connection, if the planet is a very debilitated position or in the weak planet, but is does not having any support from the benefic planet, then that system or that particular organ will get in a trouble or get in an issue here. So we should also check what is it. Varga Kundalis are also very important, especially the Dreshkan Kundali and the Naumanj Kundali. There are many beginners in this workshop, but I will give that there is two important things. That there is the 22nd Dreshkan and the 64th Navansha. Whenever there is a transit in that particular Dreshkana and particular Navansha, there are chances that patient will have a higher type of the symptoms. If there is a Mahadasha or Antardasha of that particular planet, then the symptoms or the life-threatening issue can also occur. So these are the major important things which we should check very primarily. Now, the other part comes whenever the patient or that particular person comes in front of you. We should also check the position and strength of the ascendant, sun, and moon. Because if it is a very strong, the symptoms told by the patient will be lesser than the actual. Like if the person, if you ask the person that what is the pain intensity on the scale of 1 to 10, the patient who are having the kapha dosha, kapha prakruti, he will always say that it is around 6 or 7 if he is facing the intensity of 10, because it is a very strong ascendant, very strong sun or very strong moon. Then the patient will be able to combat with this particular situation. When it is a very weak ascendant, very weak sun, or very weak moon, then with the slightest of the discomfort, the patient will come to you, or that particular person will come to you and tell that I have an intensity of 10. Because he is not able to combat with that pain. So we should always check the position and the strength of the ascendant, sun, and the moon. This is a very basic. As we go for the Vata dosha, Pitta dosha, and the Kapha dosha, the patient who are having the Vata Prakruti, they are having the lesser stability for enduring the pain. They are not able to endure the pain. The Pitta Prakruti are mostly stable and they will see very clearly on the scale of 1 to 10. Like if he is facing the issues on the pain intensity of 6, he will tell you directly the 6. They are very easy to treat because we are able to understand the position of this plan of this particular patient in a very easy way, because whatever is happening inside, he is able to tell in a very clear way to us. But the Vayu and Kapha Prakriti are very difficult to treat, because Kapha Prakriti will not say that I am facing this intensity of the pain, and Vayu Prakriti will always exaggerate what he is facing. So we should always check the position and strength of the that whenever that patient is talking to you, whenever that person is talking to you, observe them. If what how they are talking, how they are describing the symptoms. From that, we will be able to know that if the person is talking very fast, if the person is giving exaggerating, like I am facing the very high fever, I am not able to sleep in a very fast way, then they will be linked with the Vayu Prakriti. If the patient says that I am having this temperature and this is my, then this is the Pitta Prakriti, and there will be the patient is not interested in talking. They will say that I am able to bear, but my family has brought me to you. Then there are higher chances the patient is having the Kapha Prakriti here. So this we should check before. And here we will also go for the case studies. This is very interesting topic because as we have gone through the basic understanding of how the dosha and the planets are currently situated with each other. So how we will go through the case whenever the patient appears in front of us. So this is the first case study. 25-year-old male visited the clinic with the complaint of the infertility since 3 years. The patient got married around 4 years before, and from 3 years he was trying to become a father, but he was not able. So then he go for the semen analysis, and there were many files and report, and you can see that sperm count. Here is the report of the semen analysis. Sperm count is normal, so this is not an issue. Sperm motility is also 50 to 60%, so this is not a major issue. Though the progressively motile are only 50%, but non-progressive are 40, so it is about 50 to 60%. So this is okay. But the main major thing that we should see here is sperm morphology, because every sperm has a particular anatomy. Every sperm should be healthy in order to fertilize the ovum. That is the Stri Bija. Sperm is called the Purusha Bija. The Purusha Bija and Stri Bija both should be healthy. If any of them is not healthy, then there will be issue with the infertility. There is many things, like it is about only 3 to 4% sperms are normal. Many are having abnormal sperm up to 97%. Head defect are about 40%. Neck defect is about 20%. Tail defect is 30%. So and the excess residual symptoms is also linked with about 20%. So these are the abnormal sperms are on a very higher scale. So this person will not be able to conceive in a very normal way. The patient also gone for the IUI, but he was not able to get pregnancy. The reports of his wife were normal, so I'm not sharing the reports of her wife. There is also one interesting thing, that he was having the addiction of the alcohol and the tobacco since 5 to 6 years, and his sleep cycle was also very improper. He was used to wake up in the morning 12 o'clock or 1 o'clock, and used to sleep very late at night. So this caused all the issues, that his sperm started to get abnormal, and about 97% of the sperm were abnormal. So this is the main diagnosis, that it is having the abnormal morphology of the sperm. There are many patients who are also able to conceive with this abnormal morphology of the sperm as well, but there are higher chances that the fetus that gets developed is not able to develop in a very healthy way, or there will be chances of having the miscarriages or the abortion in that issues as well. Now, we will discuss about how the Ayurveda point of view. Now, as I have discussed before, that Ayurveda is theory of the seven dhatus, named the Rasa, Rakta, Mas, Med, Asti, Majja, and Shukra. So, as he is having the abnormal morphology of the sperm, it is diagnosis as the Shukra Dhatu Dushti. Shukra is linked with the semen. Shukra is linked with the sperm, and as 97% of the sperm is abnormal, it is called the Shukra Dhatu Dushti. How it happens, what is the samprapti or the issue, how that sperm gets abnormal. So whenever the kapha is decreased and vayu is increased, kapha dosha is decreased and vata dosha is increased, there are higher chances that the shukra dhatu dushti will happen. So what was the line of treatment of this patient? The patient was prescribed the medicine of the Sukra Shodhan Gun mentioned in the Charak Samhita. There are 50 types of the gun that is mentioned in the Charak Samhita. Out of that, Shukra Shodhana Gana was Shodhan means the purification of the Shukra, purification of the semen. So first line of treatment was that he was prescribed that, and he was also advised to stop the intake of addiction like the alcohol on the tobacco that he was given. We will also go for the chart of it. He was given the mantra remedy for the Venus and the donation remedy for the Jupiter, and he is currently under medication since a month. Now, this is the birth chart of that particular person. Now we can see that here we will see that Jupiter is the Putra Karaka. It is in the Sagittarius sign. So Jupiter is in a strong position because it is in the its own sign here. But one thing we can see is that Jupiter is in the retrograde motion. The sum of the positivity gets little decrease. Other thing we can see that sixth lord moon is also placed with the Jupiter. So there is a little trouble here that Jupiter and moon are here is closely placed. Second thing we will see that here that Jupiter is also having the aspect of the Saturn here. So Jupiter here is also getting little issue. Other thing is that Venus is also partially aspecting the Jupiter here. Other thing we can say that as we mentioned that whenever there is the issues with the semen, we should always check for the Venus first. And you can see that the Venus is also in the retrograde position. And whenever the planet is retrograde, it is having the higher Cheshta Bala. But there are also the chances that the natural signification will also get decreased to some extent. Whenever that planet is retrograde, you have to repeat in order to get the positive aspect of that particular planet. Venus represents the semen, Venus represents the sperm, Venus represents the ovum. But as it is having in the retrograde motion, and the Jupiter and Venus is also not in a very good manner. So this is also creating some issue. Now, as I also mentioned before, that whenever there is an issue linked with the infertility or the impotency, you should always check the fifth and the sixth house. Here we can see that the Rahu is placed in the eighth house. Eighth house is also linked with the testicles. Eighth house is also linked with the scrotum. Here Rahu is creating a little troubles. The sperm count was not getting affected here, but he affected in a way that the morphology of the sperm, the normal sperm was not produced here because he is also having the Rahu. So there is not only one thing that is creating the issue here, like it is not only the Rahu that is creating the problem here, but Putra Karak Jupiter is also having the link with the sixth house lord. The Venus is also in the retrograde motion, and eighth house is also aspected by the Saturn here as well. So this all the combination led to the abnormal morphology of the sperm. Now I will go for the case study 2. All the persons are here, or is it getting a little bored? Please give me some feedback.
It's very interesting, sir. Please go ahead.
Yeah, very good.
Yes, I agree.
Amazing.
Okay, thank you very much. Thank you. This is the second case study in which the 38-year-old female visited the clinic with support of her husband. She was not able to walk in a proper way. She was having a very large swelling and inflammation of the joint, especially finger and the knee joints. She also experienced the morning stiffness and the inability to wake up from the bed. It is the issue. The patient was also suffering from the primary infertility, but it is the secondary. The patient started to face the issue when she was going for the IVF treatment. In the IVF treatment, many hormonal injections are given, but after the second IVF, she started to get this high inflammation. She was not able to walk. She was not able to do the proper day-to-day activities as well. So she was advised for the RA factor or the rheumatoid factor test, and as you can see that the RA test or the rheumatoid factor test is a little higher than the normal. Patient was not able to wear his normal dose because she was having a very high swelling and inflammation. He was not able to wear his normal footwear because his legs get swollen. So she used to wear the chappals only. The inflammation in her hands get increased in that way that she was not able to open the laptop as well. She used to tell her colleagues to open the laptop for her, then only she was able to type. So this was the issue that she was facing. So is his medical diagnosis is the rheumatoid arthritis. Rheumatoid arthritis is a autoimmune disorder. The patient was on steroids and was told that she has to take it for a longer time period. Mostly in the allopathic science, the patient is given the steroids or the disease modifying factors or the medications that decrease the inflammation and the swelling, but it is always advised to take for a longer time period. And the patient wasn't ready to take for the longer time period. So she appeared in the clinic, and the Ayurveda diagnosis is called the Amavata. The rheumatoid arthritis is the medical diagnosis, and the Ayurveda diagnosis is Amvata. Am is a different concept of the Ayurveda. It indicates that when the food is not properly digested, it creates a waste product. It starts to get turned into the ama. Wherever this ama goes, it creates the different troubles. It creates the different signs, symptoms to that particular person. In this case, that particular ama went to the different joints and created the amavata. As you can see that she is having the 18.40 IU per ml in the 8 January 2021. Now we will go for the chart analysis here. Now we will first look at the Jupiter, the lord of the sixth house, is placed in the first house. If we go for the Bruhat Parasha Aurora Sastra, it has been mentioned that whenever there is a connection of the ascendant and the lord of the sixth house, there are chances of the physical issues or the diseases higher than the other people. Second thing is that whenever the immunity is compromised, we should always look for the sun. If the sun is trouble, the person will have the issues with the immunity. The person is more prone to have the bacterial infection, whether any type of the viral infection or any type of other infection more than the other people. So we should always check for the sun here as well. Now, sun here is placed in the enemy sign of the that is ruled by the Saturn. It is placed with the Venus, that is also the enemy of the Sun. Now, rheumatoid arthritis is, as I mentioned, that it is an autoimmune disorder in which the defense mechanism of our system or the WBC that starts attacking our own cell. They think that, or the programming changes that our cells are the enemy cells, like the cells that surrounds the joints, that surrounds the border of the joints of the fingers or in the knee joint. That particular cells are taken as an enemy, that are taken as a bacteria or the virus, and they start attacking that. So rheumatoid arthritis, in that autoimmune disease, we only have to suppress the immunity because it is attacking the own cells. So whenever there is any autoimmune disorder, we should always go for the sun. If we give the remedy related to the sun, then the symptoms will start to get better. Now the patient started to experience the peak of the symptoms when Saturn started to transit over the natal sun in after February 2020. Saturn was transiting here after February 2020 over the natal sun. So this is the one point that also triggered that rheumatoid arthritis. She was also going through the moon and the Saturn time period from the 11th January of the 2019 to 11th of the August 2020. Saturn was also going through the natal sun. Also, the moon Saturn time period was on. So transit and the Mahadasha both are having the issues here, and then this rheumatoid arthritis happened. Now, what was the line of the treatment for that particular patient? The patient was given the Ayurvedic treatment, and along with the remedies of the sun, she was advised to take the Ayurveda medicine, but also she was advised to chant the Surya mantra and also the Aditya Hridaya Stotram. She was also advised to start his daily routine linked with the sun. Like many people are having the habit that they will sleep late at night and wake up late at night, so it affects our biological clock in a such a way that the internal mechanism starts to get disturbed. So she was advised to set up her lifestyle according to the sun. As the sun rises, you wake up. As the sun sets, you start to stop the daily activity and go to sleep as early as possible. She started to follow that particular routine and the Ayurveda medicine and also the chanting of the mantra. And after 3 months, you can see that from the 18.40 rheumatoid factor, she was having 5.01. She was not on the steroid. She was not on the disease modifying agent. She was only the one Ayurvedic medicine that after 3 months, as it was only 5.01, many medicines were decreased. She's only having the Ampachanvati right now, and she is having the no troubles linked with the rheumatoid factor. So this is the result that we can see that on the 9th of the April, she was having the better rheumatoid factor, and the issues that she was facing, like the morning stiffness, swelling, inflammation, and inability to do the work from in her daily routine was also subside. So this is the very interesting case that was having the rheumatoid arthritis. Now the same patient is also facing the issue of the infertility since last 8 years. She was married about 9 to 10 years before, but she is not able to conceive till now. She has trouble with the formation of the ovum. So she was advised by the gynecologist to go for the ovum donation, in which the process the ovum is donated by the other healthy female, and the sperm of his husband is mixed with the ovum, and then the embryo forms. It is implanted into the uterus of that woman. But she has gone for more cycles of IUI, 2 cycles of the IVF, but is not a successful yet. Now, Ayurveda point of view, she has a Stri Bija Dushti. Stri Bij means the ovum, and it is having the Dushti. Now, it happens when the Vata dosha get elevated, and it creates troubles with the formation. Now, if we check the birth chart once again, this is a very basic understanding that whenever we should go for, if the patient is having the child, then we should always go for the fifth house, because fifth house is the Putra Sana. Its Lord Saturn is placed in the 12th house. Now, as there is a basic understanding that 12th house is also the Dushta house, or it is the house of losses or the Vyayasthana. So this is the main indication that it is having in the placement in the 12th house. It is also placed with the Mars. Mars and Saturn both are mostly enemies towards each other, and they do not go well with each other. There is also no benefic aspect to that particular. So she's also going for the Bija Dushti medications as well, and she has been given the chanting of the here the Saturn and the Venus both she is going through, because the rheumatoid complaints are completely subside right now. So we are giving the remedies of that particular thing right now. Now the case study 3. 28-year-old male visited the clinic with the signs of the severe depression, anxiety, and restlessness. He was also facing the extreme low self-confidence, and now was very strange that the person was also linked with the medical profession. He was a doctor and was practicing as a proctologist. He was getting very anxious about the patient that he was used to treat. Whenever there is an operation, he was used to have a restless night. All the night he will be waked up and thinking that how the operation will go tomorrow. What if I am not able to operate on that patient in a very successful manner? He was having a very low self-confidence. And even after the operation is done, he was used to say, what if that patient is not cured particularly? What if the bleeding start? What will the family members of that particular patient will think about me? Will they give or refer any patient, because I do not know what I have done? So this thing started to he started to experience that type of the symptom. Since the start of 2019, there were very mild symptoms that he was getting a little depressed and little anxious, but it started to increase more and more near the end of 2020. He went for the psychiatrist treatment and also taken the medicine. When till the time period the medicine was on, he was feeling okay. But as the medicine stopped or the dosages were reduced, he was facing the same symptom. So he came to the clinic for the Ayurveda point of view, that is this condition can be treated by the Ayurveda. So in the Ayurveda, Vata dosha is linked with the instability or the restlessness of the mind, because our mind gets restless or the unstable only by the Vata dosha, because Vata dosha is not stable. Vayu or the air goes from one end to another and very easily. For the water we have to wait, and for the any of the rock or that type of the thing, earthy element, there is a very hard effort should be done to move them. But vayu is a very unstable, very restlessness. So when vata dosha is increased, symptoms like anxiety, restlessness, and depression is increased. So he was given the medicine that reduce the vata dosha, and in the charaka, Medhya Rasayana Gana is a group of the 10 medicine that is indicated in the Charak Samhita that gives the CNS system a little rest, and that helps to induce more efficiently. So this is the birth chart of that doctor. As we can see that he was having the issues linked with the depression, anxiety, and the restlessness. First, we should check the moon. The moon is in the debilitated position and having the close connection with the Rahu. So this is the first thing, that moon, it is in the debilitation, and the Rahu connection is also there. Other thing that we can notice that is Saturn is also aspecting the moon. So moon was already debilitated, having the connection with the Rahu, and also getting the aspect from the malefic planet Saturn. There are missing the benefic aspects here. So this created a little issue. Now we can also see that the moon that is placed in the Scorpio sign, its dispositor Mars also goes into the sixth house of the diseases. So this created him these are the main ingredients of that depression, anxiety, and restlessness. But when this particular type of the dish will be served, when because the patient started to get mild symptoms since the 2019, around 2020 it started to get decreased very more. So we can see that from the 22nd, 22 September 2020 to 12 April 2020, there was also axis of Rahu and Ketu going here on. So it triggered, and native was also going to Venus Rahu time period from 9th of the September 2018 to September 2021. So transit and the Mahadasha triggered the symptoms. Now the patient is in a very stable manner, and he is able to operate on the patient without any having any type of the issue. What was the line of the treatment? As mentioned before, he was given the Methya Rasayan to work on his brain and help to decrease the anxiety and to increase the focus. He was also advised to chant the Narayan Kavacha and the Bula Mantra. Moon, as mentioned, it is in the debilitation position, and the Narayan Kavacha. Why the Narayan Kavacha? So there is a one story where there was a Samudra Manthana, or the churning of the ocean by the Deva and the Asuras. So Vishnu Bhagwan, Narayan avatar come, take the avatar of the Mohini, and he started to distribute the nectar or the Amrut. But one Asura, Svarbhanu, who was able to understand that whenever there is a Deva, the Amruta or the nectar is given, and whenever there is a Asura, the Sura is given or the alcohol is given. So Deva is getting immortal, but Rakshasa or the Asura is not getting immortal. So he transformed into the Deva, in the roop of the Deva, sat with the Deva and drank the nectar, and he became immortal. The sun and moon, they saw that this is the Asura and he is not the Deva, so they informed the Mohini. Then Vishnu avatar came and they cut his head. The head is taken as the Rahu and the body is taken as the Ketu. So in that story, the remedy is also given that we should always go for the Narayan for any issue linked with the Rahu and the Ketu. So he was also advised to chant the Narayan Kavach. Native has started to get better and now he is off the meditation, but he has still continued the Narayan Kavacha and the Mool Mantra because he feels more positive and optimistic after chanting of the mantra. So he is now not on the allopathic medicine. He is also not now on the Ayurvedic medicine. He just now recites the Narayan Kavacha and the Mool Mantra, and he does not face the issues that he was facing in the last time period. Now we will go for the similar case study. It's the fourth case study. The patient visited the clinic with a very huge file, a bunch of reports and the medication. He was diagnosed as the ILD. It is the interstitial lung disease. It is an umbrella term to indicate the group of the disorders of the lung, which indicate the pulmonary fibrosis, carrying of the lung tissues, and the inflammation. The patient was having a shortness of breath, fatigue, weight loss, and coughing. Symptoms got very much aggravated when he travels or any change of the food is done. So, as a medical point of view, he was diagnosed as the interstitial lung disease. As the Ayurveda point of view, it is diagnosed as the swasa. It has been mentioned in the Sanhitas that when Kapha dosha and Vata dosha increases, Kapha obstructs the normal path of the Vata dosha, and then it creates the Swasa Roga. There are many type of the Swasa Rogas. It is the Tamat Swas and Tamat Swas. There are many type of the Swasa Rogas. The patient was diagnosed as a Swasa Roga. Now we will go through the birth chart of that particular person. Now first we will see that where the Saturn is placed. The Saturn is the lord of the sixth house, and it is placed in the first house. And in the previous chart, we also seen that the sixth house and the first house connection. It indicates that there are strong chances of having the chronic issues or having the chronic troubles. Whenever there is connection is mentioned, they are more prone to having the diseases of that particular thing. Now as the patient is having the lung disease or the lung issue, because he was diagnosed as the interstitial lung disease, we should always check for the fourth house. Now we can see that the fourth house lord is the Jupiter. It is in the retrograde motion and is having the link with the lord of the house of diseases, that is the Saturn. So Jupiter and Saturn both are here connected. So this is the one thing that is creating the issue. Now, as we mentioned that we should also go for the natural significator of the fourth house, that is the moon. Moon is placed in the Cancer sign, that is its own sign. This is a good, but it is also having the Rahu here. So it is causing a little discomfort to the moon. Though the moon is able to fight back to the Rahu due to his positive power here, but Rahu is still able to disturb the moon. So fourth house lord is also troubled by the sixth house, and the moon is also little troubled by the Rahu. And we can also see that moon is also aspected by the Mars here. So these indications are linked that fourth house is very much having the troubles. Other thing that we can note that the 12th house lord, this is the one of the Dusthana, is placed in the 8th house. This is also the Viparita Raj Yoga, but here it is creating some troubles to that because sun is also linked with the immunity. It is having in the sign of the exaltation, but still the patient's immunity was having trouble here. Native has experienced the mild issues. The ILD was diagnosed in the year 2019. Now we will go for the transit when he was diagnosed the ILD. So Saturn was transiting here in the fourth house. So this created the trigger. Whenever any type of the disease happens, always go for the Mahadasha and also go for the transit. It will give you the many basic. It is a very basic understanding, but it will give you the many basic knowledge, many basic way to treat that particular person as well. And native started to experience symptom in the Dasha Sandhi time period of Ketu and Venus. Now, if we go for the Venus here, we can see that the Venus is placed in the own sign. Why that patient started to feel the issue in the Dasha Sandhi time period, or still is facing the issue in the Venus time period. As I mentioned before, there are two basic thing link with the Varga. 22nd Drishkara and the 64th Navansha. Both are the points that are the very important points to be noted. Whenever there is a disease included, always check what is the Lord of the 22nd Drishkana or the Lord of the 64th Navansha. So Venus is the Lord of the 64th Navansha, and when the Venus Dasha was about to get started, the patient started to feel the issues. Jupiter, Saturn was already here. Rahu Moon was already here. Saturn was also transiting here. So this provided the trigger, and the 64th Navansha, it is also called the Khara Navansha. So this also created the issues with the related with the lungs, interstitial lung disease here. Line of the treatment, ILD is a disease which cannot be cured completely, and the scarring done cannot be reversed. It can be managed with certain medications, and quality of life can be increased, because ILD patients of the ILD are not getting cured in a very easy manner. There are no such medications till now that cure ILD completely. Some patients are very lucky to have it in increase in a very slow manner or a very minimum symptom, but it cannot be cured completely. So patient is currently under allopathic and Ayurvedic, both the medicine is mostly stable, but the lung capacity is decreased to some extent. Now native is not able to speak the mantra, so he was advised to speak the mantra of the Jupiter and donation to the pregnant woman and the breastfeeding mother, because they are linked with the moon. So here we are trying to give the positive power or the Daiva Prashya Chikitsa by the way of strengthening his Jupiter and also the moon. Now, this is the fifth case study. It is linked with the ACL tear, or it is called the anterior cruciate ligament. Whenever the knee joint, there are many ligaments linked with the knee joint, and the first and most essential is the anterior cruciate ligament. Anterior means the above or in the front. Posterior means the back side. So this is the anterior cruciate ligament. This is the posterior cruciate ligament. So native age male, 34 male, visited the clinic with the history of the multiple complaints related to the knee joint. Its major injury happened when he was playing the cricket, and he suddenly started running and stopped to catch the ball. But that time his knee got this injury, and whenever the MRI was done, it was indicated as an ACL tear. He went for the surgery, but still facing the pain and swelling from time to time. It was difficult for him to stay without painkiller. At least 2 to 3 times he has to take a painkiller. Now, this is a little information about what is the anterior cruciate ligament. It is this anterior means above in front of cruciate ligament in the knee. It joins the thigh bone to the shin bone at the knee. Most ACL injuries are the sports injuries, or whenever any person tries to in a very fast, running very fast or going very fast and suddenly stop, then all that jerk comes to the knee and the ACL or the posterior ligament gets torn. Ayurvedic point of view, it is indicated as the abhigata or the trauma. Abhigata means it happens in a very sudden manner, or something stops, or some things gets directly crash into the knee. So it indicates that due to that the vata dosha increases due to it, and it leads to the masa meda and asti dhatu vikruti, because ligament is also linked with the masa and the meda, and as a knee joint asti dhatu is linked, so this is called the asti dhatu vikruti. Now, this is the MRI of his left knee joint. We can see that here in the impression. It is a complete anterior cruciate ligament tear. The bucket handle tear of the medial meniscus was also there. Grade 1 sprain of the medial collateral ligament was also there. And there are also many mild synovial effusion can be seen. There are sprain injury of the posterior posterolateral capsule, and main thing was happening that his knee joint was having many type of the issues. Though he went for the surgery, the symptoms were there. He was not able to have a symptom-free time period even after the surgery. Now, if we check the chart of that particular patient, as we gone that 10th house is related with the knee joint and the bones. Now we can see that here we are having the Ketu placement here. Ketu, as I mentioned before, it indicates the cuts as well. It indicates little medical attention as well, because Ketu is the headless body, and wherever it goes, there are chances that it will create a cut. So, in the knee joint, he was having the anterior cruciate ligament here. Now we will also see that how the 10th lord is placed. 10th lord is placed in the 6th house of diseases, though it is in the exaltation, but still it is in the house of diseases. So this is creating a little issue here. Mars, the lord of the 8th house, is placed in the exaltation. But as we talked, that 10th house or the 10th sign is linked with the knee joint. So this also indicates a little connection of the 6th house with the knee joint here. The injury of the knee happened on the 10th of the November 2019, which was in the last phase of the Saturn Jupiter time period. Saturn is the natural karaka of the knees, and it is also in the retrograde position. So here we can indicate that he was having the higher chances that he will have the knee joint issues. All the persons who are having the Ketu in the 10th house will not face the issues if the proper care is taken. So medical astrology can be taken also as a tool, as a preventive medicine, that what type of the diseases we can get in the future. So we start to get more cautious about that particular part or particular system. Like if in this case we can see that there are higher chances that the patient will have the issues with the knee, then we will start to get take care of the knees from the years before, so that whenever that impact occurs, it can be decreased to some extent. Other thing to take here, that the patient was also suffering from the IBS, which is indicated as the irritable bowel syndrome. So here we can see that the Mercury is in the debilitated position in the 5th house. This is linked with the a digestive system. Sun is also there, so it is creating some troubles to the patient here as well. He was given the line of treatment as the patient was complaining about the pain, inflammation of the knee, stiff joint in the morning. We went for the Janu Basti procedure. Janu Basti is an Ayurvedic procedure in which the particular type of the floor is mixed around the knee, and according to the symptoms, the taila or the oil is selected. It is heated, and it has been kept at the knee joint for a particular time period. Whenever it gets little cold, the oil is replaced and the new oil is filled. This is called the Janu Basti procedure, and he was also advised for the certain help that helps in the healing. Now he was advised to strengthen the sun, being the 10th lord. The sun is still in the exaltation position, it is strong, but for that particular healing, for the inflammation, he was advised to strengthen the sun. He was also advised to do the donation related with the Saturn. The patient started to feel better after a month, and he has still continued the chanting of that particular Sana mantra, and also the donation to the Saturn, like donation to the old age home. So this was my presentation. I am thankful again to Mr. Muthu Vijayan sir and all the listeners who listen to me and give me opportunity to represent myself. Now, if in that presentation any questions are related or any other question that you are having, you can ask me.
Thank you, Milan. It's a wonderful session. All your case studies are really interesting. So thank you so much. Let's open for the Q&A now.
Sir, I have one question. If for a Leo ascendant, if Rahu is placed in the 8th house in Uttar Bhadrapada Nakshatra, and the Nakshatra Lord Saturn is in the Lagna, and
Yes.
the depositor of the Rahu, that is Jupiter, is retrograde in Sattvisha in the Aquarius. So what kind
Yes.
of disease or fatality can be seen during the Rahu Mahadasha?
Just a minute. Can you repeat me?
Rahu
Rahu is
is Rahu is in
Place.
the 8th house, Pisces,
Yeah.
in Uttar Bhadrapada Nakshatra for Leo
Okay.
ascendant.
Okay.
Then its Nakshatra Lord Saturn is in the Lagna, that is in Leo.
Okay.
And the depositor Jupiter is retrograde in the Aquarius or the 7th house.
Yes.
So thereby Jupiter, Rahu and Saturn are looped together, right?
Yes. Yes. Yes.
So my question is, what kind of disease can be predicted during the Rahu Mahadasha? And
Uh,
will it?
Yes, first we should check where the Rahu is placed. Rahu is placed in the eighth house.
Yes.
Now, eighth house is linked with the urinary system. So,
Okay.
if the patient is a male,
Yeah.
then there are chances that he can have the issues related with the prostate or the recurrent urine infection can be seen.
Okay.
Recurrent infection can be seen whenever the sun is transiting in that particular time period. Sun is transiting in the Pisces or in that particular nakshatra, there are chances that inflammation can be there. There are higher WBC in that as well. So patients should always take care of the urinary system. Other thing that we should take care is the feet of the native or the eyes of the native, because it is also placed in the Pisces, and Pisces is linked with the eyes and also the feet. So there are chances that some of the issues can happen related with the circulation to the legs. So these are the main things that we can see. Other thing we can say that particularly six Lord Saturn is placed in the first house. So
Yeah.
the person can be more prone to the disease because sixth house is directly connected to the first house. So person should always take care about strengthening the ascendant here. So on the basic understanding, we should take care of the urinary system, especially bladder and the prostate. These are the main thing that patient should take care. If the patient is having 40 plus, 50 plus age, he should go for the sonography. If the intake of the fluid is not proper, then he should always take care of the intake of the fluid. This is the basic thing that person should take care.
Thank you, sir. Thanks a lot.
Yeah,
Right.
Ram here.
Yes, Ram.
Yeah.
In one of your earlier slides, you had showed Jupiter as Kapha planet, and
Yes.
of course Saturn as Vata planet.
Yes.
But isn't Jupiter also involved in Vata also, because it's a gaseous planet? And I have seen some charts where in Jupiter in 6th house or anything, people have a lot of gaseous troubles.
Uh, yeah, actually, there is one basic thing that Jupiter slows down the thing, because Jupiter is a very slow planet as well. So whenever it is placed in the sixth house, then the food that passes through the intestine gets slow. There, because of that, the patient can experience the disease related with the gas or something like that. But if the Jupiter is placed in a first house or in the, then the person will go for the kapha type of thing. So Jupiter is the kapha planet, but it obstructs the natural movement of the vata in the intestine. Because of the longer time the food stays in the intestine, that patient will also have the constipation issue, and because of the constipation the gas is forming. So this issue can be happening.
Okay, sure. Thank you.
This is Karthik here. So
Yes,
my
sir.
question is having Vata, Pitta, or Kapha body type a lifetime thing in general, or can the body type change over a period of time, especially with
So,
age?
whenever the person is born, his prakruti is fixed. It is like the DNA. The Whenever the person is born, the DNA is made and it is fixed throughout the life. So, Vata, Pitta, and a Kapha prakruti, the prakruti that is made at that particular time will be throughout his life. But the intensity can be changed as per the Mahadasha the person is having. Like if the person is having the kapha prakruti, so generally the person will be seen as a very slow person, very stable person, very calm person, very polite person, who is looking for the knowledge, who is not reacting in a very but if that person comes into the Mars, then the intensity of that kapha will get decreased to some extent, but it will not be changed. It can be decreased about 10 to 20%, but not fully decreased. The Prakriti will be fixed once that person takes a birth.
Thank you very much.
Is there a way to determine whether a person is more of Vata or more of Kapha, or like any numerical number? I believe some numbers are there for each planet or
Yes,
position.
actually, there are many question and answer related with it.
Mm,
That what type of the skin that person is having, what type of the
mm,
eyesight that person is having, what type of the appetite is having.
mm,
Is he is more resistant to cold? He is more resistant to heat. So many different things are taken in consideration.
mm,
If the person is taking the water type of the food, then if
mm,
he is having the gastric issues, if the person is having the hyperacidity, if the
mm,
person is facing the constipation. So there are
mm,
about 25 to 30 questions, and out of that, from the inspection of that person, from the communication or the from the signs and symptoms, we can determine that which type of the prakriti the person is having. And like as mentioned in that presentation as well, if we see that in which zodiac sign that person is having the planets, like
mm,
if the person is having the Leo ascendant, there are chances that he is having the Pitta Prakriti. If the
mm,
person is having the Aries ascendant, but there are many other placement that we should also see here, because
mm,
ascendant gives some part, Sun gives some part, Moon gives some part. If all are placed in the Aries sign, if all are placed in the fiery sign, there are higher chances that the person will have the Pitta Prakriti. If
mm,
many placements are seen in the watery sign, then he will have the Kapha Prakriti. So we should check. There is also one other method that is called the EPVJ method, in which we calculate that how many planets are placed in the Aries sign, how many planets are placed in the earthy sign, how many planets are placed in the fiery sign, and and ascendant is also given the 10 marks, 9 planets are also given the 10 marks, and out of that we can also calculate that if the person is having the major placement in the Aries sign, then the person will be having the Vata Prakriti. If the person is having the major placement is, and so there are many things that we should consider by the
mm,
darshan prashna examination, and also by the having the kundali analysis. So it will
mm,
help us to determine the prakriti of the person.
mm. Okay.
Yeah. Then
Yeah.
Vikram, you want to ask something?
Yes, sir.
Yeah, please go ahead,
Doctor,
Vikram.
first of all, excellent presentation. Very, very well
Thank,
articulated. A lot of good
thank,
examples. It was beautiful to see the analysis and how you use it to help people. Fantastic. Okay.
thank you, sir.
Just a few questions, Doctor. So first is, do you ever consider nakshatra in analysis?
Yes, I have tried to keep it as basic as possible, because many of the participants are having the basic. So nakshatra is also taken into the consideration. Sometimes whenever the nakshatra is used, specifically the kandanta point are also used. Nakshatra is also having the kapha, vata, and the pitta nature. So whenever we go to deep, and when we want to know that how much vat that type of person is, like if the person is having the vata prakriti, but some person will have the extreme vata prakriti, some person will have the very low vata prakriti. So in that manner, we can take the nakshatra into the consideration.
Okay, so an example would be if I have Jupiter in, say, in a Saturn nakshatra and Jupiter
Yeah.
in a Sun nakshatra has got different meanings.
Like Jupiter is having in the Jupiter is a basic kapha planet, but
Yeah.
if it is the Saturn nakshatra, Saturn is the Vata, so it is like kapha plus a Vata. So he is having the kapha, but kapha is little decreased by the Vata, so he will have the flavor of the Vata. If the Jupiter is placed in the nakshatra of the Sun, so it is Sun is linked with the Pitta, so that both type will be little different from each other, though they are having the kapha prakriti, but kapha vata will be little bit different, and kapha pitta will be little bit different. They will both will be having some type of the similarities, but there are many points in which they will not match with each other. So this is the basic thing that we can see, that there are many things that we can see, that how they both are different from each other. Basic thing will be the same, but the flavor will be different.
Okay, one more question, sir. How is
Thank you.
retrograde of planets considered?
Yes.
Retrograde. Jupiter retrograde will be
In
a
the
normal.
In
How
the medical
different?
astrology, retrograde planets are taken whenever I see there is a no natural movement of that particular thing. So I mostly go for the retrogression. There was a one patient who was having GERD, in which the reflux is there. The patient was not able to contain the food, so it is the reflux. Then the retrogression will be there. If the patient is having the same thoughts again and again and again in his thinking pattern, then the retrogression will be there. If the patient is having the symptoms of OCD, then the retrogression can be there. If the patient goes for the frequent micturition, then the retrogression will be there. So when there is a repetition, or when the natural path of any material, like the feces is not getting normally accepted by the rectum, the food is not going down but it is going up, the acid is not going down but it is going up, then we should check the retrograde planet, and there is mostly the retrograde planet connection you can see there. So in the medical astrology, whenever there is a no natural path, or when there is a repeated movements are seen, then retrograde planets are considered.
Fantastic. Great answer, sir. Last question on my side. So, in your analysis, do you refer to Karakatvam of planets? For example, I say Sun is heart, fifth house is heart, and Leo is heart. Or
Yes.
Venus is kidneys, seventh house is kidneys, Libra is kidneys. So, which has given you more results?
First, mostly I check by the house. First, I check the sixth house. If there is any placement in the sixth house, then it will be considered as a first point. Because if you knock the door, who will open the? If you knock that house door of the house, who will open that door? The planets that are living in it. So first, I go for the sixth house. If there is a no planet or no connection with the sixth house, then I go for the Karakatva. If there is a no connection with the Karakatva, then only I go for the Rashi. So this is the way of working I mostly do. That if there is a no planet in sixth house, then for the Karakatva, then the zodiac signs.
Okay, so sign comes last in analysis.
Last.
Yeah,
Yes.
so it is first the house or from the ascendant, second the Karakatvam, third is the. Am I right?
Yes.
Thank you so much, doctor. Nice session. Fantastic.
Thank you,
Thank you.
Vikrant. All are good questions and very good answers. Anil, you have any questions to ask?
Yes, Muthu. Thank you, first of all, for this presentation. It was quite interesting for me.
Thank you, sir.
My question is maybe a little bit more to Muthu, perhaps. I mean, can birth defects of the bones be seen from medical astrology?
Birth defect of the bones can be seen in the medical astrology if there is a connection with the sun. Mostly, whenever the bone is connected, sun is also taken. Sometimes I take the Saturn into consideration as well. Whenever the sun and Saturn are connected, then there are higher chances. If the sun is the lord of the 22nd Rishkana or the 64th Navansha, then the birth defect can be seen from the medical astrology as well. If you have any particular chart, you can send me on my email or WhatsApp so that we can discuss more about it.
Okay, I will do that. I have one more question. I mean, we saw two examples where you showed when Rahu is conjoined with Moon, then there is a tendency for depression. I mean, is this this is always the case when, I mean, it is irrespective of the house. For example, if I have a chart where Rahu and Moon are conjoined in the Hasta Nakshatra in the 5th house with a Taurus ascendant, will this also indicate or show some potential case for depression?
So, mostly when the Rahu and Moon are placed, there are chances that the issues linked with the depression and anxiety will happen. But it will only happen when the Mahadasha is also having some effects and transit will also having the effect. Not all the person with who are having the Rahu and Moon will show the depressive tendencies, or if there is a beneficial aspect on the Jupiter, or like Jupiter is there, beneficial planet connection is there, then there are chances that the patient will not show the symptoms. But if the moon is not in a better place, moon is missing the aspect, and the Saturn transit comes over the moon, Rahu and Ketu axis comes over the moon, then there are higher chances that the patient will have the depressive episodes, or the anxious episodes, or the restlessness episode. The intensity can be plus or minus, but the person will suffer in some type of the mental issues in that time period.
Okay, thank you so much.
Welcome.
Thank you, Anil. Karthik, you have any questions? Like you raised your hand.
Yes, sir. I have one question.
Yes.
We spoke about arthritis, and we spoke about sun being responsible for, sun being, we need to analyze the sun. So when a planet comes very close to the sun, usually it's that other planet which gets combust. So in this
Yes.
case, let's take an example for say there's a Taurus ascendant and the sixth lord also becomes Venus.
Okay.
So in that case, if the sixth lord is conjoined with the sun in the fourth house, so
Okay.
are we looking at the sixth lord having an impact on the sun? Because usually it's the sun that combusts the ascendant lord in this case. So in
Okay.
case this person I know has arthritis, so
Okay.
what is your take on this?
Uh, we can always see that there is a connection of, as we also discussed in one case, that the sixth house is having the connection. Sixth house lord is the house of disease lord. Its work is to create the diseases. So though it is combust by the sun, but still the sun will show some effects. If there is a missing of the no Jupiter aspect is there, mostly this if Saturn is also connected by the sign of the aspect and other thing as well, then the person will having the osteoarthritis. If the person is having the direct impact, here the sun is placed in the own sign. So it will, there are lesser chances that patient will go for the rheumatoid. There are chances that patient will have the osteoarthritis type of the qualities as well. So as if sun is conjoined with the sixth lord, because the Taurus ascendant, for the Taurus ascendant, but the Mula Trikona sign is the Libra. So it will first give that particular six connection, and after that it will give the ascendant connection. So this person will have the arthritic changes. But one thing is that Sun is in a own sign, so the intensity will be lesser. If the sun is not in a favorable sign, then the intensity can be a very much higher, and the patient is not easily manageable. Here we can give certain type of treatments and certain type of medication, then the patient can have the better effects.
Sure, sir. Sir, so just to be clear, it's the Venus that is causing the
Yes, yes.
arthritis or the sun.
It is a Venus that is causing the arthritis because it is having the connection with the sun. Because though it is in a combustion mode, but still it will give some issues linked with the bones.
Okay. Thank you so much.
As it is
Yeah.
connected to the Dushtana house law. Yes.
Okay.
Yeah, one question related to the same thing. Is a rheumatoid arthritis is only that is because of autoimmune, or all type of arthritis is because of autoimmune, like from medical standpoint?
Rheumatoid arthritis is there are very many different type of arthritis like osteoarthritis. Osteoarthritis is mainly seen like the person is overweight, the person is walking very much fast without any proper nutrition. He is not able to do the take the normal nutrition. Then both the knee joint will start. There is a one disc between both knee joint. It will start to get decreased, and the bones will start to get friction with each other. So in that time period, it is mostly called the osteoarthritis because it is done by this type of the movement. In the rheumatoid arthritis, the condition is very different. The both the joints in the X-ray will show very much normal, but the symptoms will be there. So autoimmune disorder is the rheumatoid arthritis. There is one also gouty arthritis. In that, it is called the gout or the vata rakta when the uric acid crystals starts to get deposited in that joints, and it is a different time kind of arthritis. There are many different arthritis, but rheumatoid is autoimmune. Other type of arthritis is not having the autoimmune category.
Okay. Thanks. So, actually, you have any questions? You raise your hand. Okay. So, anybody else have any questions?
So what indicates the disease will lead to death or like to the maximum extent like this?
Mostly for that deadly diseases, we should check the 64th Navansha Lord, the planet that is connected with the 8th house.
Sorry.
We should always check for the 64th Navansha, like in the case I discussed ILD, interstitial lung disease. The Venus is placed in a very favorable position in the D1 chart, but it is the Lord of the 64th Navansha, and as I discussed that ILD will not get cured completely. We can decrease the progression of the diseases to some extent, but we cannot cure it. And as the lung capacity starts to get decreased, then it will create the death of that person. So there are chances that issues related with it. So always look for the death. But as in the astrology, death is not much discussed. So whenever it is done, look for the 64th Navansha. We can get the hint that how disease will affect that particular person.
Okay, thank you.
Sir, I have got a question regarding you said that if this Rahu and Moon get conjunct or they are together, then it may bring depression. Now, what about the aspect? Now, let us say if Rahu is aspecting Moon, fifth aspect, assuming that Rahu has an aspect.
Yes, aspect also gives. Yes, aspect also gives some effects, but it will not give that intensity or that much issue. Because when you are sitting with an enemy and enemy is only watching you, then there will be a different type. But if there is a no connection, no positive connection to the moon, and only Rahu is watching, then whenever the Rahu transits over the natal moon, or whenever the Rahu moon time period comes, the patient can face symptoms, but it will be not that much intense. That patient needs to have a very active medical treatment for that particular case. Symptoms will be there, but intensity will be less.
And if it is in the 5-9 relationship or 6-8 relationship between,
hello, yes,
then also the depression will. What will be the intensity of depression? Assuming that Rahu and Moon are in 5-9 relationship or 6-8 relationship.
yeah, if there is a 5-9 relationship, there are chances. Here we should also check how strong the ascendant is, how strong the sun is. If ascendant and the sun is also having some issue, then the Rahu moon will surely give you troubles. If Rahu Rahu is placed in the 6th from the moon, or Rahu is in the 8th from the moon, then the issues will be there. But if from the ascendant, it creates more issue. That will from the moon, it will only create a mental impact, but the physical impact may be less, or the actions may be little lesser. So this is main thing that we should check.
Thank you, sir. Thank you so much.
Thank you. One last question. We'll take, I think one person raised the hand. Yeah.
Hello. I was
Hello.
wondering, there's a phrase used here in the US, an ounce of
Yes, Michelle.
ounce of prevention is worth a pound of cure. With this multidisciplined approach, can you give us some advice or suggestions on how to use it for preventative or proactive types of interventions? Thank you.
Medical astrology can be used as a preventive tool as well. Like we can go for that particular birth chart and see that what issues can occur in the future, or we can say that when the particular malefic planet is transiting over the 8th house or over the weak part of the of your horoscope, and then we start to get little cautious about that particular thing. Like Jupiter is in debilitation, then there are higher chances that the person will face the issues linked with the cholesterol, the person will face the issues linked with the lipids, the person will have the issues linked with the fat products of the body. Then we will start to get lesser the intake of that junk food, or we will start get to the normal diet. Then that issue can be resolved to some extent. If the person is having the malefic connection with the 4th house, like Mars and Ketu are placed in the 4th house, 4th house lord is not so good, then there are chances that the patient can have the heart or the cardiac issues. So start to get take care of your cardiac system way before. If your Mars Mahadasha is arriving and Mars and Ketu are placed in the 4th house, so start to be cautious about that cardiac system. Start to have a walk. Start to add the diet that helps in the cardiac system. Then the intensity can be decreased to some extent. So the medical astrology can be taken as a tool for the prevention of that particular disease. If your son is in a very weak position, in the debilitated position, so that immunity or the fighting spirit will be get little decrease, your confidence may be little decrease. So we should always work for that missing thing that is happening. Like in the allopathic science, if you are not having the normal vitamin B12, you will be prescribed to have vitamin B12 capsules or injections of the vitamin B12. In the same way, we can check the chart, and we can add that particular type of the food or that particular type of the daily regime that can help to combat in that particular situation. We cannot completely ignore it, but we can decrease the impact of that upcoming issues to some extent.
Thank you.
Yeah, one last question on behalf of Nitika.
Can I ask it?
She is asking like any books for beginners in medical astrology. Your suggestions?
There are there are many medical astrology books available. You can choose. Mostly, I have learned from patient to patient. Like for any books, you can go for the basics. Mostly, all the books give the basic in a very much clearer way. But as you see the patient, as you interact them, it is the best thing that we can learn from them, because the patient comes in front of me and tells a certain type of the symptoms, certain set of the questions, then we can understand. So major thing I will advise or request to talk as much as possible with the patient that is suffering from that disease. If take one disease, any cardiac disease, meet 10 person who are having the cardiac issue, check 10 birth chart that are having the cardiac issue. It will teach you more than any other book, because you will start to get a direct connection of the person who are having the symptoms and its birth chart. It is the main thing that we should go for.
Okay, got it. Thank you so much. I think you should write a book on this. You have a lot of experience, and also you have a lot of patient details.
Okay, can I ask a question?
Ratnakar, yeah, please go ahead.
Yeah. So for Vata in Ayurveda, is there a corresponding thing like in allopathy, like any vitamin deficiency that causes Vata?
I'm not able to understand your question.
Yeah, my question is, say, like in Ayurveda, there is Vata, right? Vata dosha. So people who have high Vata dosha, is there any pattern in allopathy? Did you find any pattern in allopathy? Say like a
So
person is
mostly the hyperactive, yes, hyperactive persons in the medical science are considered as the Vata type of people. There will be metabolism little higher. They will be very much the person that are facing the gastric troubles more and more. They are very hyperactive. They are very reactive. Then in the allopathic science, we can consider them as a Vata Prakruti person. But one thing is that no one is only Vata, no one is only Pitta, no one is only Kapha. Most people are having the mixture of Vayu as a dominant, Pitta as a little less, Kapha as a more less. So all the people are the mixture of this dosha. But that particular symptoms will be very much high in the Vata Prakruti people.
okay. But is there any vitamin deficiency in allopathy that causes Vata in Ayurveda?
Not particular any vitamin that it creates, but mostly it is we can say that their way of reacting things. The person Vata Prakriti person mostly gets the issues linked with the bones because they have having the many fragile bones. There are also chances that the skin will be very rough. There are also chances that the digestion will be improper. So not particular type of the vitamin deficiency can be seen, but the minerals deficiency can be seen in what type of person.
Oh, okay. Yeah. Thank you very much.
Welcome.
Okay, thank you, Milind. Actually, you spent a lot of time answering all the questions patiently. So thank you so much for having this session. I think we took a lot of your time today, especially your weekend.
It's my pleasure, sir, to actually work with you, sir.
Okay, thank you so much. Thank you so much. Thank you all for spending a lot of time today.
Sir, this is an excellent,
Thank you.
excellent use
Thank
of
you.
weekend. Thank you.
Great, great. Thank you.
Thank
Thank you so much. Thank you so much. And meet you all again through another session. Thank you, Milind. Good night.
Thank you so much.